Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock, and today our discussion's going to focus around the importance of actually establishing a relationship with your primary care provider. And joining me today is Dr. Gregory Shaw, who specializes in family medicine with Hardin Memorial Health's Family Care Center, Freeman Creek. Thanks for being here with us.
Thanks for inviting me.
Well, tell us a little bit about, and I know you specialize in seeing a wide range as far as the age bracket's concerned. You actually start at age 5, correct?
Yes, I mean, we will see younger than that, but typically people will say, you know, cradle to death, so. And
it's important, you see family medicine, so families can establish that relationship with their primary care provider. And tell us why it's important to actually start it so early and follow the patient through the lifetime.
You know, there's lots of, conditions that will travel through a whole lifetime. Sometimes knowing, one's family history can be important. Even sometimes one's family dynamics can be important. But it's really establishing a relationship with that patient, that individual, over a good number of years. It's a relationship that works, both ways. We get to know them, they get to know us. Oftentimes, as that relationship grows and flourishes, a lot of things that we know about each other makes care a lot simpler, easier, efficient, knowing what works, what doesn't work, patient preferences.
Those are important, and I think too, you actually specialize that, as you get to know that patient and they partner with you in what is normal for them, what their personal history is, their family history, and why is it important to know both your personal history and your family history in that care of that patient?
Well, some of those things, does put the patient at increased health risk. If they have a family history of heart disease or diabetes, certain cancers, that patient will be at increased risk to get some of those things. Sometimes because of family history, we can do some screening, genetic screening, to see if they may be at even higher risk, for some of those things like breast cancer, and having them check to see if they carry that genetic mutation that may put them at higher risk.
Now, when a patient comes in for their first visit, maybe as they're getting to know, and again, we're talking about kind of partnering with your primary care provider, what should they bring, and what do you need to know, I guess, as you're working with them?
Usually the patient should know their own personal health history, what kind of medical problems they have, what kind of medical problems that they've been treated for in the past, previous surgeries. It's always great for them to bring all their medications, just to stick it in a bag and bring it along, trying to recall any allergies, and what those allergic reactions have been. Sometimes it's important to even call up, family members and update what your family history is. It's usually not something people talk about, at family reunions. So even just taking a day or so beforehand, just take a piece of paper, jot a few notes down so that you're prepared when you come in. You don't have to try and remember at the last minute.
And of course, if they're coming in, we need to establish, I guess, the difference between what maybe an acute visit would be and maybe a chronic visit, and tell us a little bit of the difference there.
Usually someone's coming in for, acute visit, they have something acutely wrong. They have a cold, a sore throat, an injury. It's something that happens suddenly. It's going to be self-limited. It's going to go away. And then someone has something chronic. It's an ongoing medical condition that just needs to be monitored. Sometimes it needs to be treated. Treatment needs to be modified, changed. And so usually those they have to come in periodically for. An acute visit, once it's gone, it's gone, and we don't really usually worry about it again until they have another acute episode.
So, right, that kind of resolves itself, and then the chronic is actually managed then over a period of time, correct?
Yep, managed. We're looking to make sure the treatment's working well. They're not having any side effects or adverse events from their treatment. They're not having any consequences from their chronic illness. So, like with high blood pressure and diabetes, we're always looking at and monitoring their kidney function, because over a period of time, particularly if it isn't adequately controlled, it can affect their kidney function. They can develop other things like vascular disease, heart failure, and so we're always monitoring that to catch it earlier rather than later.
Well, we've talked about acute, we've talked about the word chronic as far as different visits. We don't need to necessarily go to the doctor only when we're sick. It's real important that we start learning to take responsibility for our health actions. So we're hearing a little bit more, and should have, I guess, all of us looked at preventative care and what we can do to take responsibility for our health actions. How can we partner with our healthcare professional with the preventative care that we need to have the good quality of life?
Yeah, I mean, usually most times, with the kids, we see them all the time, as everyone comes in for those newborn visits and stuff. But once they get to a certain age, particularly once people get to be teenagers, they just sort of drop off the map, and then particularly into adulthood. And we only then start to see them for those acute things, and by not really maybe taking care of their health overall, those acute things may be more frequent. Their health may be deteriorating. So by coming in on a regular basis for preventative medicine, we can talk about other things other than the acute care management, just to stay healthier. My analogy usually is just sort of like an old classic car. Our job isn't necessarily to make people live longer, but to live better. You have an old classic car, you take care of it, you store it in the garage, keep it out of the sunlight, you put good fuel in it, you do all that routine maintenance. People look at it 30 years later and they go, wow, I can't believe it's 30 years old. Well, they took care of it, they maintained that vehicle versus one that was just sort of let to run amok. And our bodies are sort of the same way. If we take care of and do that routine maintenance, get them checked out, preserve them, down the road, we're going to, our health typically is going to be better than it would have been if we just sort of let it run amok.
So routinely, as we look at some of the preventative types of steps that we should take, what are some lifestyle habits that we all could maybe instill in our daily routine?
I usually tell people, if someone came in and said, Dr. Shaw, what can I do to be better? The first question, number one, is, do you smoke? Hands down, smoking has the greatest adverse effect on one's health, so by changing that, it can have the greatest benefit. Number 2 and 3 sort of go together, diet and exercise. So usually I tell people the top 3 things. I mean, unfortunately for us, you don't really even need us. But there are lots of great tools out there to help people to be more successful, to quit smoking, the guidance that people may need to help with a better, healthier diet. Sometimes people don't know if it's safe for them to start exercise and come in and be checked out and see how they're doing. Maybe sometimes to check some numbers beforehand, and so that as they move along in these lifestyle modifications, to see the benefits that they're achieving.
So I heard you say numbers. What numbers should we know?
Well, it's always nice. I mean, there's lots of medical conditions that are asymptomatic. People are not going to feel bad. Hypertension. So it's nice to know your blood pressure, the top number, the bottom number. We look for it to be under 140 and under 90. Nowadays, everyone wants to know their BMI or their body mass index. It's a calculation based upon your height and weight. We really at least want it under 30, if not more ideally under 25. Your cholesterols, I say really the two most important numbers is your BAD, your LDL cholesterol, depending on your risk, what that should be. We would say at least under 140. Of course, it's a rather muddled thing these days that to actually calculate one's risk, you have to have an app. So, and then your good cholesterol, your HDL, we're looking for that to be over 40. And so oftentimes by knowing a lot of these numbers, and I will oftentimes plug these numbers for an individual into this app and say, oh, your 10-year cardiovascular risk is, and depending on what it is, what is their 10-year risk of having a cardiovascular event, a heart attack, a stroke, heart failure. So if they're at increased risk, we should be more aggressive to treat them.
So you're looking then at their personal risk compounded with their lifestyle habits that they have on a daily basis, and then also their family history, and all those things work together to affect our health.
Yeah, I mean, the #1 cause of death of adult men and women is cardiovascular disease, so we look at all the modifiable risk factors, diet, exercise, tobacco, alcohol use, cholesterol, blood pressure, diabetes, all these things we can change for the better to lower that risk.
Now, one of the other numbers, we need to check our glucose level too?
Well, there's not much indication or evidence that says for screening for blood sugar. Many of these things, like being overweight, does put us at increased risk for diabetes. So to be on the lookout for those signs or symptoms of diabetes, and then to check.
So when a person comes for their office visit, I know we talked about earlier making sure that they bring their medications, they know their family history, they can discuss their routine habits with the primary care provider too. If they are coming in maybe experiencing something, maybe during that acute phase that they might have too, it helps if they're a little specific in description of what's going on, correct? And have those signs and symptoms ready for you, I heard you say.
It's best. Sometimes people have difficulty conveying some of that, and so it's it's sort of up to us to try and pull that information out as best as possible. And then at least start some of that evaluation. Hopefully then, even as they get through some of that acuteness, come back and we can then start dealing on some of these other things, these possibly chronic medical conditions, and get them thoroughly evaluated, get them treated.
So we know the role of the patient that's coming to see you. They need to take responsibility for knowing what's going on and sharing that information. I think there has to be a good communication level. What's the role of the primary care provider?
I always tell people, we are more like their primary health care consultant. We're like a business consultant. They come in, you open up your books, you open up your business. They look and see what you're doing right and what you're doing wrong, and then try and make that business, more profitable. So as a primary care healthcare consultant, we, come in, you open up your health history, tell us all about it. We identify those things and give you the tools and the directions and everything you need to improve your health. Unfortunately, once the patient sort of walks, out the door, it's up to them. So hopefully we've given them all the tools and the directions that they need to be successful, and that hopefully as, they'll come back on a regular basis, we can continue to encourage that, hopefully keep them on the path to better health. And I always say, sometimes along the way we end up being their own little cheerleader to, continue to incentivize them to have a good and improved health.
Now, primary care provider also works with somebody, maybe one of the physicians or providers that specializes in certain areas, and also communicates on a regular basis with the hospitalist if one of your patients would be admitted to the hospital, correct?
Yep, I mean, there will be times that some people will have to have a specialist care. That person has a heart attack, have abnormal kidney function, they have an orthopedic issue, a broken bone. So it's very important to have that communication, to know what's going on both ways. Sometimes someone may need surgery, but the person may have had a recent health issue that some things may have to be considered beforehand. Some more preoperative evaluation, changes, delaying surgery, other more critical evaluations just because of that, by getting that health history, by having that communication.
I'm sitting here thinking it's almost like the coach. I mean, they're there with you, and then if something else is needed, they bring other team members on to take care of that, to take care of that patient too.
Yep. So we'll try to orchestrate with all those that need to be, hopefully along the way, like say that person's had a heart attack, the cardiologist is going to come in and take care of that acute stuff, but we're sort of the ones there every day taking care of all those other things to hopefully maybe to have prevented it, delayed it, prevent a second one by addressing all those risk factors that are ongoing.
Now, we've talked about preventative care too. What are some basic screening tools? I know we talked about blood work, mammograms, colonoscopies. Do you usually talk to the patients about when they should start those types of things too?
Yep, usually, it starts, young women, pap smears, as women get older, mammograms, men and women colonoscopies. Probably the biggest part of preventative medicine that people actually overlook is immunizations. Preventative medicine at its simplest. We're not treating, but we're preventing these illnesses by getting our tetanus shot, our diphtheria, our pertussis, our MMRs. Nowadays, people are getting the chickenpox vaccine, the shingles vaccines. You know, we get our annual flu vaccine. You know, so we're really preventing illnesses before we ever have to treat them.
Very good point, because you had said earlier too that usually that starts when the infancy through, you know, childhood, you're getting those immunizations. So as an adult, we forget that we need to do those. And flu shots annual, we should get
Annually.
every year. What about pneumonia? And then I also heard you say shingles. About what age bracket should we start talking to our provider about those issues?
Well, some of those depend upon the insurance company. It's so that, you know, depending on one's insurance coverage, you know, when they will cover you to get them. Usually, so, you know, shingles 60 and up. The pneumonia has always been one of those fickle kind of vaccines. It has always changed over the year, and in the last year they've changed it and added a second type of pneumonia vaccine in. So we use a Prevnar, and so you'll get that one, and then a year later get our traditional pneumonia vaccine.
Working together then.
Working together.
Okay.
Some people may be at increased risk for certain things, but they have chronic lung disease, and we will want to immunize them, you know, much earlier rather than that 60, 65 years of age.
Okay, now I heard you say, we've been talking about the, you know, preventative things that we can do with our lifestyle. I think, I know as a healthcare professional, there's also one that we probably need to discuss, the importance of hand washing. What do you think?
Well, hand washing is good. You know, my personal belief is we've almost become too germophobic in some of these antimicrobial, antibacterial things. We may be getting rid of too much of the good. But hand washing, particularly during a lot of the cold and flu season, obviously as one uses the restroom, those are always important times. You know, when we're sick, you know, we always, you know, talk people, you know, rather
Just
than
a good habit.
coughing, sneezing in their hands, it's always to the elbow. But even still, all those important, you know, things. Just simple soap and water. So.
Well, and I think you made me think about it with the immunizations and talking about flu. You know, that is something that we can all do again. Back to that responsibility is making sure that we are washing our hands well, not spreading the germs, and you know, staying home when you're sick so that you don't spread that too.
Yeah, I mean that gets to be difficult in this day and age, as so many employers, you know, tend to make it difficult. People are sick. You know,
But generally, if you're running a fever.
Yeah. If you're running a fever, you know, it'd be nice to stay home. It'd be nice if employers sometimes would sort of see the light in that versus all of a sudden you have a whole factory out with just a little gastrointestinal thing as it makes it path around. So people, you know, feel they can't miss work, don't want to get in trouble,
But general rule of thumb, if you have a fever, you want to be afebrile.
Yep, at least a day. Stay home, get your rest, hydrate. Simple things.
Yep, take care of yourself. We've shared some great information with us as far as preventative care, also the importance really of partnering again with your primary care provider. Anything else you'd like to share with our viewers this episode?
You know, it's just a relationship that starts. You know, it does take a while to formulate a relationship. It's not a office visit, it's several office visits over a period of time. You know, depending how young and healthy one is, that can take years.
And I think too, it's a two-way street. You're communicating, and if you're given the prescriptions or you're given maybe the treatment, the suggestions that are made by the provider, you have to make sure you're following through with that, and or sharing what's working and what's not working. What are the barriers?
Yeah. And sometimes, you know, there are, you know, nowadays, you know, lots of barriers. We tend to wear many hats. Sometimes I feel like, you know, we're a financial advisor, social worker. You know, some of these medicines are very expensive, or there are other barriers. So, you know, we're working with that, and some of our other, you know, colleagues, social workers, and financial people at the hospitals and stuff like that, to try and get the patients the care that they need. You know, and everyone there is for that same objective.
to have a good, healthy quality of life as best as you can for that person, Well, we appreciate your time today. For more information and maybe to seek a primary care provider, go to www.hmh.net, and we hope you tune in next month for another important edition of Health in the Heartland.